Hi, it's Dr. Noel Robert Williams, Oklahoma City, Oklahoma, Optimal Health Associates. March 21st, 2020, my daily COVID-19 update. We're going to go over a couple new things today that I think are really important. And we're going to try to focus, I think, a lot more on the positive. But first we're going to start with just numbers. There's about 305,000 cases in the world right now that are documented. There's probably a couple million, it's just there's no testing in a lot of places. So we have 305,000 documented, we have over 13,000 deaths, so again, big jumps in both numbers. There are 800 deaths in Italy today. The United States, we're at about 25,400 or 500, approaching, I think, right around 300 deaths. So I think we're getting to the point where if we don't shut down in the next few days, we're going to have huge trouble. But we'll see. I think it will happen Monday or Tuesday at the latest, but we'll just have to wait and see. If the government doesn't tell you to shelter in place, you need to shelter in place. I'm talking to different medical executives in the Oklahoma City community, David Chansom again, the head of infectious disease at Integris, amongst others. Every one of them would tell you, stay at home, don't go out. I mean, you can go outside, but you don't want to be around other people. You want to isolate yourself at this point. The disease is here, it's spreading very rapidly. There's been several deaths in Oklahoma City with people just coming in fulminantly ill now in the Oklahoma City area and passing rapidly when they got to the hospital, and if they didn't get tested, they will not get tested. So the testing situation here remains abysmal. I'm day 5 from my test, and I've been updated that maybe I'll have it by Monday or Tuesday. So kind of interesting. Several other people I know who were tested because of exposure, again, same thing, and basically no timeline on getting that back, which is a little disappointing when there's other states that have same-day results within 2 to 3 hours. 4 at the outside. Stanford's doing that. A bunch of places in California and all over the United States, but we can't even get results back in 5 to 7 days in Oklahoma. But there's nothing we can do about that right now. A new rapid test, though, a point-of-care test, meaning you could get the results literally within 45 minutes, was approved by the FDA today. So hopefully that will be rolling out in the next week or so, which will be helpful to get an idea of what the disease load is here. But I can tell you from talking to different executives, again, at the hospitals in our community, many of them are starting to get filled up, and I want to give a lot of credit now for things, because Oklahomans and everyone in the United States is innovative, and I'm sure this is helping everywhere, but I can tell you in Oklahoma, we have local companies now who are switching their manufacturing. I help connect, since I get a lot of information from people on what's going on, we helped connect a manufacturer in Guthrie with one of the hospitals today, and they got 55 gallons of purifier or sanitizer. And some of the breweries are changing. Lots and lots of people in our community are helping out any way they can with changing production, focusing on things. At the hospital level, the people in the hospitals are really working hard on trying to find ways of using equipment that was purposed for one thing and applying it to the COVID, taking instrumentation that's reusable and really getting it up to snuff, or older equipment and revitalizing it so we'll have more availability for ventilators and things like that in our community. And that's definitely going on at all the hospitals. People are making masks for hospital providers, and that's really what I want us to focus on for a minute. I have an Oklahoma City challenge, and I have a challenge for the entire United States. There's not enough masks for the hospital workers. The hospital workers are under such tremendous stress. They're scared, they're nervous, they're taking care of these sick people, and they don't have protective gear. So a simple thing people could do is just go online and look on how to sew a N95 respiratory mask with a pocket. This is a N95 respiratory mask. It also has a little air vent. I don't think that's as important. But inside, there's a pocket. Right here in that pocket, there is a N95 filter, this size, and the dimensions will be online. The problem is this, not this. And so the next thing we all have to do is there's people like me who could tell this was coming. And then there's people who are preppers. And so one of the things that I've done is I got supplies before this all started. So the first thing I'm going to do when I get out of quarantine is I have about 200 of these little filters that will go in those masks. And I'm going to bring them all over to Baptist Integris so those people there can have it. Each one of those filters within one of these masks gives a week of protection. So we're basically giving 200 weeks of protection to healthcare workers, or 100 workers for 2 weeks, or 200 workers for 1 week. There's lots of people who have these in our community. There's lots of people who have other supplies, N99 masks, N95 masks. If you were someone who went to Home Depot a few weeks ago, because I was in there looking to see if there were any N95 masks before it hit, and someone in our community bought all the N95 masks at the Home Depot on May Avenue by 63rd. How about donating them to the either OU or Integris or St. Anthony's or Mercy or some of the big hospitals? So each one of you kind of evaluate what you have, what you can do, and bring it to the hospital. They need masks. If you have gowns because you have an aesthetics practice that you know you're not going to use now because aesthetics practices should be closed. If you have other things that are protective gear or could be helpful, let's go ahead and get that to the local hospitals that are going to be the ones on the front line. And again, this is a challenge for everyone. I'd encourage you to send this little video out to everyone you know in Oklahoma City and across the country. Donate, donate, donate to the hospitals. They need your help. Those people are putting their lives at risk. Think about the pressure that they're under, knowing that they're dealing with a lethal disease every day, and if they catch it, they could die. So let's really focus on that. And then let's talk about volunteerism. Call the hospital and see what you can do to help. If you're a physician like me, I'm a gynecologist with a wellness practice. So what am I going to do? Well, I reached out to Integris today and volunteered to become part of the care team. So once I get off quarantine, since I have privileges there, I'll go through EHR training or electronic medical records training, which seems pretty intimidating since they have a different system. And then I'm going to be a supportive physician in some level at the hospital for the COVID effort. I don't know where they're going to stick me, but I can take care of sick people still, not as well as I think an intern is, but still pretty good. And I'll be basically the smarter doctor's intern, which is okay. And that's what we all have to do, is contribute in any way we can, and that's another challenge to physicians. Hey, we're doctors, we can handle this, we got to step up and help these hospitals. So that's all the central things I want to talk about, except for the questions about Plaquenil and Zithromax. Plaquenil is an anti-malarial drug and a anti-rheumatologic drug that has been shown in several small but definitely well-done trials in China. There's also been some from Europe. There's some data, I believe, a little bit from Iran, that shows that Plaquenil is extraordinarily effective for inhibiting the COVID-19. So the Chinese government has made the decision that it's a first-line therapy in China. In the United States, there is something called an investigational new drug exemption. If you're a licensed provider, you can use a medication that is FDA approved for a purpose other than what it was approved for. And we all do that every day in practice. I mean, if you think about an antibiotic like Keflex, it may have been approved for cough, cold, and congestion or sinusitis, but you could use it for cellulitis in your ankle. I mean, there's a lot of things we do that for. So it is completely legal and reasonable to do that. The issues with Plaquenil are more long-term issues. If a short course of 5 to 10 days is very unlikely to have much in the way of side effects other than GI side effects, which are very, very significant. So you have to take it with food. But the longer term exposures do correlate occasionally with more significant things like eye damage or some hair loss, but there's some debate about that. Maybe even some hearing loss, but just short courses really doesn't. There's also an association with some cardiac arrhythmias in a very teeny tiny subgroup, which brings up the point about Zithromax. So Zithromax is an antibiotic, and there's a French study that talks about using them together. It's teeny tiny. I think it was about 20 patients, and those patients did well. I don't think that data shows that adding the Zithromax to the Plaquenil was better than just Plaquenil or chloroquine by itself. But the issue is the Zithromax, or azithromycin, as it's known generically, causes a little cardiac electrical abnormality too, which is the same one that Plaquenil can cause. So if you add them together and you're the wrong person, it's called a QT interval change. It could be significant. So I don't think taking them together, one, is really scientifically valid, or two, with the cardiac risks, makes a lot of sense. Even though it's teeny tiny, it's going to happen if a lot of people do it. And if you get a cardiac arrhythmia that was bad, it could kill you. So I definitely would discourage using Zithromax with Plaquenil. In terms of getting Plaquenil, I think most of the supplies in Oklahoma are pretty much gone, so there's not really a need to call your doctor for one. I think what you have to do now is just wait. Novartis is going to make about 130 million doses over the next 6 to 12 weeks. Mylan Pharmaceuticals thinks they'll have another million doses ready within a few weeks. So there's going to be this massive production of Plaquenil in this country. I mean, it's a very, very commonly used generic. So I think we'll be in good shape on the Plaquenil within just a month or so. So that's kind of the other point, is the Plaquenil, you're not going to really be able to get it now. So it needs to be more reserved for the hospitals and the government anyway. So it is available if you get sick. And that's really about the summary tonight, I think. We don't need to really hash out some of the stuff going on in Oklahoma because we don't have any testing. I would really encourage you to stay home as best you can, stay optimistic, and believe in the goodness of others, because there's a ton of people stepping up in our community to help everyone. And if I think we put the word out locally and nationally that hospitals need help, and us people who are nerdy preppers need to step up and start giving all our stuff away to help the community, because if we don't keep those healthcare workers going, then we're all going to get sick and we're all going to be in trouble. And say a prayer for all of the healthcare workers. They're under huge psychological strain. Imagine being a nurse in the ICU every day, dealing with these patients, and the pulmonologists and the critical care doctors and the respiratory therapists. I mean, and the people working in the cafeteria, knowing there's all these infected people in the hospital, and they're putting their lives at risk for us every single day. And we need to appreciate them and love on them and care about them. And that would be my message, and may you all be safe.